Good evening. My name is Debbie Nappi. I am a co-leader along with Susan Reed, who is the lead partner of our firm's healthcare practice here at Saks. We want to welcome you and thank you for taking the time to join with us tonight as we navigate during this unprecedented time. We will provide you with timely information regarding the challenges and the new protocol for the daily practice of dentistry. As the practices have reopened, they have been faced with the myriad of operational, personnel, and financial challenges, with patient safety being of utmost importance. We have great content in store for you, and we know that you will walk away from this time with helpful information. First, we're just going to give you a disclaimer, just letting you know that we are providing you with informational content, but if you are making any pertinent decisions, please speak with your professional advisor and to assist you with that situation. We also would like to present to you today's agenda. This is what we will be discussing throughout the webinar, so we just want you to know what it is, what will be coming next. We also, for those of you who are not familiar with Saks, we just wanted to provide you with a little bit of information about who we are. We have been named on the top list of the 100 accounting firms by both Accounting Today as well as Inside Public Accounting. In addition, our Saks Wealth Advisory has also been listed by Accounting Today. We have recently announced our joint venture with Safari Solutions. We have formed S2 Technology Solutions, and this enables us to help our clients with their technology needs. In addition, I am sure that many of you on the call have been on our weekly webinars regarding the PPP loan options and forgiveness strategies. So we will be having an upcoming one this Thursday. So please be sure to join us for that as well. Here's a screenshot of our panelists as well as our contact information. We will be providing you with an audio of tonight's recording, but if you should have any questions that you would like answered, please feel free to reach out to any one of us listed here, as well as we're going to give some opportunity at the end for some questions. So our first presenter is Susan Reed. Susan is the lead partner of our firm's healthcare practice here at Saks. She has over 30 years of providing both tax and advisory services to her medical and dental practices. She has also served as a CFO of a medical practice for a few years, which has provided her with valuable insights that she now provides to her clients. Please let me introduce to you Susan Reed.
Coronavirus Aid, Relief, and Economic Security Act, or CARES, was passed by Congress and signed into law on March 27th, providing over $2 trillion of economic relief. $50 billion of this relief was allocated in a general distribution fund under the control of the Department of Health and Human Services. The first two rounds of funding by HHS were provided to those that participate with Medicare programs. And finally, on July 17th, HHS announced the distribution of approximately $15 billion to the Medicaid, CHIP, and dental providers. Under the program, eligible dentists can receive funding equal to 2% of their annual reported patient revenue. So for example, if your practice collected $1 million in 2019, you would be eligible for payments of $20,000 under the program. These payments are not loans and do not have to be repaid. However, you do need to agree to the terms and conditions, so be sure to review those. Now, you'll see a link of the website where you can go and get more information on those terms and conditions, as well as other frequently asked questions about the distribution. And as Debbie mentioned, All participants will be emailed not only this webinar recording, but also the presentation deck, so that you'll be able to access all the website links you're going to see throughout our presentation this evening. So now on to the application process. There's a link at the bottom of this slide as well, where you're going to be able to access the application for funding. The program is being administered by United Health Group, and therefore the first step in the application process is to set up your Optum ID if you don't already have one. The next step is to validate your TIN or tax identification number, keeping in mind that this can take 1 to 2 days to receive once you apply under the program. Once you get the tax ID number validated, you'll get a link to then actually prepare the application. But while you wait for that, a few things you should get ready to upload during the application process. You're going to need a copy of your most recently filed tax return. You're going to need to prepare an FTE worksheet that lists the providers in your practice. And you're also going to need to supply a copy of the first quarter Form 941 form for your practice. You'll also need to calculate the decline in revenue for the months of March and April of 2020. Now, fortunately, the deadline to submit this application was just extended from July 24th through August 3rd. So certainly time is of the essence, and you want to get to that website and click and submit your application as soon as you can. Now, to set the stage for our webinar, we thought we would take a 30,000-foot view on where things stand nationwide. Debbie and I have been following the surveys done by the Health Policy Institute of the ADA. As of June 29th, 97% of dental practices in the U.S. were open, with 42% reporting business as usual and 55% seeing patients at a lower volume than normal. Later in the presentation, Dr. Gorab is going to provide us with some insights on how to re-engage your patients. Now, if we break that patient volume down further, it appears that the volume nationwide is starting to level off, reaching approximately 70% of pre-COVID levels. We'll have to see how much the capacity continues to grow, or if we are at somewhat of a leveling off point. Collections always tend to lag production. So while the collections are continuing to increase, and you can see that on the right side where they list the percentages, they are just reaching 63% of pre-COVID levels. And finally, the question of the week Debbie and I enjoy following on the 29th of June asked about the breakdown in number of patients seen by day by practice size. And 24% of solo dentists were operating at pre-COVID levels, 43% of groups from 2 to 9 providers operating at pre-COVID levels, and groups with 10 or more, almost 50% of them are operating at their pre-COVID volume. So now I'm going to turn the program back over to Debbie, where she's going to review some updates on the EIDL and PP program.
Thank you, Sue. We just wanted to spend a few minutes just to go over the EIDL loan program in conjunction with the PPP program as well. We know we have spent so much time on this as a firm, but just given cash flow constraints, we just wanted to just highlight some of the issues. And like I said, you will have the opportunity to email any of us. So anything that you have questions about or you're unsure that we are not covering or we're just going through quickly, please take the opportunity to email us and we will respond to you. So in regards to the EIDL loan, which is the Economic Injury Disaster Loan Program, which is part of the SBA programs, how can these proceeds be utilized? Because now that most people have utilized their PPP dollars, they're really reconsidering this just for cash flow in the practice at this time. So some of the considerations are, it can be used to provide paid sick leave to employees unable to work due directly to COVID, maintain payroll to retain employees during business disruptions or substantial slowdowns, which clearly this is, meet increased costs to obtain materials unavailable from original source due to the supply chain interruption with our PPE equipment, make rental or mortgage payments and repay obligations that cannot be met due to your revenue loss. However, given all that, and just keep in mind the EIDL loan is a 30-year loan, so you have considerable time, it's a low interest rate to repay these dollars. But how does it interact with the PPP loan that you may have already received? So if the EIDL loan was received from January 31st of 2020 to April 3rd, and it was not used for payroll, there's no impact on the PPP loan and forgiveness. If the EIDL loan was received during that period, and was used for payroll costs, then the PPP loan must have been used to refinance the EIDL loan. Then we have the issue of the grants that were issued by the EIDL loan initially. So you were able to receive $1,000 up to a maximum of $10,000 per employee. If you received that initially prior to filing for the PPP loan, your PPP loan should have been reduced by those dollars. If you received the PPP loan initially and received these grant dollars afterwards, up to $10,000 will not be allowed for loan forgiveness. So like I said, please feel free, email us with any questions, but just wanted to touch on that. And then another area that we wanted to touch on were various covered costs that we've gotten some clarification on. So if you're a C Corp, owner-employee, both your retirement payments and health insurance are forgiveness eligible as a covered cost. If you're an S Corporation owner employee, the retirement contributions made are forgiveness eligible. However, now the health insurance contributions are not. So you can still use your PPP dollars. However, they're not going to be considered covered costs and eligible for forgiveness. Then we have the Schedule C or Schedule F filers, if a Schedule F is for farming. Here we're just given the limitation of the compensation, which goes back to the $100,000. So it's either the $15,385 over 8 weeks or $20,833 over a 24-week period. And then we have a calculation here for our general partners as to how you then determine compensation for net earnings. And lastly, self-employed individuals, including Schedule C filers, as well as Schedule F and general partners, they're excluded from both retirement and health insurance benefits in the forgiveness requests. So just wanted to bring that to your attention. Now we're going to move on to the remainder of our presentation, and I have the pleasure of introducing our esteemed panelists today. We are truly honored to have both Dr. Glenn Gorab, the founder of Clifton Oral and Maxillofacial Surgery Center, as well as Tracy Armstrong, an employment law attorney with Wilentz. Dr. Gorab is a thought leader amongst his peers and has much to share with us today as he is on the forefront of re-engineering his practice in a post-COVID world. He is sought after by his colleagues as he presents them with weekly communications as he guides them in practice management during this time as he gleans on his experience of 35 years in private practice. Dr. Gorab has been honored for years as being named one of New Jersey's top dentists, as well as the state's top oral and maxillofacial surgeons. I could take so much more to tell you all of his accolades, but with due respect, here is our presenter, Dr. Glenn Gorab.
Debbie, thank you very much for that very kind introduction. To the attendees, my email is going to be listed several times throughout the presentation, and you should all feel free to email me any questions you have. We could really talk for hours on this, but I'm going to try to limit it to about 20 minutes. These recent events have caused tremendous changes in the way we practice, and it brings to mind Darwin's Origin of Species, where he states that it's not the most intellectual of the species that survives, nor is it the strongest, but it's the species that survives is the one that's best able to adapt and adjust to the changing environment in which it finds itself. And that's our environment in dentistry right now. Early on in the whole crisis, if you look at the date of this New York Times article, this was March 15th, 2020. And this article came out and it highlighted the top right corner where dentists, hygienists, and oral and maxillofacial surgeons are. So this article that came out very early showed that we're really at high risk for contracting the disease. So besides the tremendous changes that we've had in our sociability and our lifestyle, the practices are seeing more change than the way we do business in the last 4 months than we have in the past 30 to 40 years. There are many considerations to change your dental facility, not only to protect your staff from patients, but also your patients from your staff and patients from other patients. It's very important that you rely on the guidelines of organizations that are trusted, and read these guidelines specifically because they will often say suggested recommendations to consider. These aren't necessarily mandates, and you have to use your own decision-making process in what you decide to do. The topics we're going to discuss today are changes in the facility, staff considerations, re-engaging patients, and productivity. So the facility itself, I think we've all trying to install these barriers between possible contact areas, plexiglass, clear plastic barriers, areas where the interface of the reception area is with the front desk or any other checkout areas. Also, if you don't have the ability to do this, then you should try to seat people at least 6 feet away from each other. The air conditioning and ventilation modifications, and these are all in some of the references I'm going to give you later, these are from the CDC guidelines specific to dental facilities, and I would encourage you all to look at it. You'd like to try to increase the fresh air intake. If possible, have separate supply and return ducts in the treatment rooms, install UVC or far UVC germicidal lights, and keep exhaust fans running. Also, portable air purification units. Couple things to consider. Consider the square footage of the room that you're considering putting it in, and buy appropriately. Consider also how noisy they are. If you buy them from Amazon, buy them, try them. You don't like them, they're too noisy, return them. Consider the long-term replacement cost of the filters as well. It might not be the cost of the device, it might be the cost of the replacement filters. Staff considerations. It is incumbent upon you to be the leader. You educate yourself and know the facts. You went into this practice because you're the captain of the ship, so therefore you are the expert. If you don't show leadership, the public hype will infiltrate into your office through your staff. You have to allay fears about contracting this deadly disease to your staff. The NJDA recently released a bulletin that reassured the staff and the office personnel that, among many other facts, there has not been a single documented transmission of COVID in a dental office. You have to provide appropriate, when available, PPE to your staff and use it in a location-specific basis. The front desk does not need an N95 mask, nor do you need them for consultations as you would in opera dentistry. Again, follow the CDC guidelines for contingency plans in the event of PPE shortages. It's also important to keep your staff informed. Have weekly meetings in person with social distancing or Zoom conferences to continually provide weekly information and how to fine-tune your office protocol and procedures. Morning temperatures, symptom checks for doctors and staff, and also question your staff about any possible contact with infected individuals. COVID testing for infections and antibodies will be discussed later by Tracy. So re-engaging your patients. This is actually from Spear, and so I didn't make this up, but it brings up the point that there are three different types of patient. There's the fearful patient, and this patient is truly scared that they are going to die if they come to your office. You must preemptively provide them information about your office, all the changes you're made and how you're looking forward to seeing them. Maintain a positive attitude. When your staff calls them for an appointment, make sure the staff knows the information and should not hesitate. Let them know about all the changes in your office and be prepared to answer questions about safety. Let them know that safety is your main concern. The next is the financially challenged patient. This patient has encountered economic hardship during this crisis. They may have lost a job or had their salary significantly reduced, so that dentistry is not the most important thing to them at this time. Try to encourage them to continue with routine treatment so what is now routine does not become an emergency. Utilize either in-house or third-party financing to help them get through the financial cost of this. And then there's the third patient. I call this the let's get going patient. This patient, nothing phases this patient. He's ready to start where you left off in the middle of March. They value your service and can't wait to have their work completed and get their hygiene visit. But no matter who it is, all the patients need to see the changes in your office. The changes include the physical items, the equipment, the procedures, anything you're doing that you can show them to show them that they can feel safe when they're in your office. Productivity. With new procedures in place, more time will be needed for patients. Not only will their check-in be more time-consuming, but the length of time for procedures, room turnover also will be greater. Hygiene visits are likely to be increased between 15 and 30 minutes. With time, this may be reduced. And it's important to monitor this extra time, but for now, more time is needed. There's an increased cost of the PPE, for which you may or may not decide to charge. The ability to have people waiting in the reception area may be limited or non-existent at all. The overall result, keeping your staff at the same pay level, increased cost of supplies, need for more time in your hygiene appointments, and the increased procedural time will result in decreased productivity and profit. And later on, I'm going to touch on dental aerosol if we have time, because there's some new research on that. So relating to the profit is either driven by decreased overhead, increased fees, or seeing a greater number of patients. So let's address these one by one. With these factors, you can reevaluate your suppliers and the cost that you're paying for materials or services. Don't be shy about saying to them, you've got to do better on the cost of these things. Judiciously raise your fees, but with this, you must communicate the value of your service. Try to negotiate better reimbursement rates with your insurance carriers if in fact this is a large factor in your practice. And work on your efficiency. Getting patients in and out of the office as quickly as possible is critical to increasing your productivity. Try to limit the number of times they leave the room, having all transactions and appointments completed in the treatment room. Some of the takeaways of this is that this is really our new normal. You have to accept it and adapt to it. This is not going to change anytime soon. Buy and make changes of whatever you're doing based on science and not the hype. Use the guidance of reliable agencies like the CDC, NJDA, ADA to make a best effort at compliance. No one's going to be possibly 100% compliant. This situation will not change until there is either a vaccine effective to be long-term effective, proven to be effective long-term, definitive treatment or cure for the disease, and reliable instant testing in the office that is a reality and affordable. Again, only reliable sources should be used to make decisions. This is all my opinion. Many of the modifications to our procedures and our offices are best effort attempts and steps to consider in an attempt to adhere with compliance. In the end, you will be held to the standard of care in the community. And right now, this standard of care is based on regulatory and professional organizations. These are some of the references that you will get in your handout slides later. Two from the CDC, one on social media and how to communicate with your patients. The NJDA, the state of New Jersey, and the American Dental Association has a wonderful resource. And I want to thank you for your time right now. And if we have time, I'll answer some questions later on.
Dr. Gorab, thank you. Our next presenter is Tracy Armstrong. Tracy is an esteemed attorney at Wilentz and will share the many employment law matters that have resulted during this pandemic during the past few months. I've had the pleasure of working with Tracy and promise you that she will provide you with valuable content for the employment law matters that are being presented to your practice at this time. She has over 25 years of representing employers across all industry sectors. She's an experienced litigator. She brings strategic insight to both the legal and commercial ramifications of complex and dynamic employment law concerns. She is also a frequent presenter to professional groups and associations, and she conducts compliance training covering important employment law concerns, including anti-harassment and anti-discrimination training and family leave issues. Tracy has also been honored as both an attorney and her humanitarian efforts for charitable causes. Please welcome Tracy Armstrong.
Hi, everybody. Thank you very much for this opportunity to speak to you regarding the impact of COVID-19 on the workplace. And sometimes I don't even know where to start. I was talking to my fellow presenters earlier, and I said, you know, next week I'm supposed to talk on the Me Too movement. And I said, I don't really think I can do that. One, not a lot of people are at work, so we don't have a lot of opportunity for sexual harassment in the workplace. And plus, you got to keep 6 feet away from me. However, even though those type of cases may be slowing down a little, employment law issues arising from our employees coming to work, working remotely, trying to come to work, are still happening, and happening in ways that we could not have imagined a year ago. So I think to start the discussion, you have to go back to the beginning is, did you retain your employees? If so, under what conditions did you retain your employees? If you didn't, do you want to hire those employees back? So real important from a fundamental perspective is, if you decided to have your employees no longer work for you, a lot of people are hung up on, did I furlough them? Did I lay them off? Did I terminate them? What does it mean? I'm going to tell you, it means nothing. It means zero unless you are over 100 employees and you're worried about the WARN Act, which even that was tabled during this pandemic. So the words mean nothing. The important information when someone leaves their work is for the Department of Unemployment. Why did you leave? Why were you told to leave? If you were stealing, you're not going to get unemployment. But if you were furloughed, laid off, or terminated because of a pandemic, you're probably going to get unemployment. If you did terminate someone who had a contract, you had to deal with those contract issues. Now, a lot of people are saying, okay, if I want to bring them back, what does that mean? It's interesting because people assume that furlough means I got to give you your PTO that you had and your sick leave and all your benefits. The answer is a definite maybe, and it's not based on the word furlough, it's based on the laws. So for example, if you have someone who left you and comes back within 6 months, you don't start them all over on their New Jersey earned sick leave. They get to start as though they hadn't left. If the gap is, and under everything is fact sensitive when we're talking about the law, for general purposes, if the gap is less than 13 weeks, you can bridge the insurance, or maybe your insurance provider allowed you to keep people on COBRA, or on the policy, even though they weren't working, they were furloughed. Because in this pandemic, I was convinced that was never going to happen, and it did happen. Insurance companies said, no, we don't want 1 million people on COBRA or 2 million people on COBRA. Let them stay. If you think you're going to bring them back, we'll give you till July 31st. Some even, I've heard, September 30th. They don't have to. We're going to waive the actively working requirement, keep them on the insurance. So those are questions, if you're going to bring these employees back, that you have to answer. And if you kept employees on the payroll, did you keep them on the payroll full-time, part-time? Did you keep them on the payroll? And if they were full-time, exempt from overtime, and you're now converted them to an hourly employee, make sure that when you bring them back, we're all on the same page as to what that means. Do they meet the duties test to again become exempt from overtime? If not, then if they work over 40 hours, you better be paying them overtime. And if you are paying them hourly and they work over 40 hours in a week, you better pay them overtime. So you have to ensure that your exemptions are still there. Now, what I mean by that is the duties test is a requirement to pay someone a salary. And a lot of employers during this pandemic said, I can't afford to pay that salary because I know they're only working 20 hours a week. So I'm going to pay them hourly. You can do that. Can't go the other way. Can't have someone who's entitled to overtime and say, I'm going to only pay you a salary. But someone who's salaried can be paid hourly so long as you pay them more than the time and a half for over 40 hours a week. So you just have to make sure that the position you're bringing them back to, the duties allow them to be exempt, because maybe the duties are different now. Maybe they're not managing people because everybody's working from home. So you just have to be careful. You don't want to try and be resolving one employment situation and end up with another employment situation. And if we could kindly go to the next slide, that would be great. So what happened was when this next law first took effect, it was in the middle of March of 2020. And I had the unfortunate conversation of saying many times the following, and I will preface what I said with, you don't have to tell me that my path to hell is paved by the things that I've had to say over the last 4 months. I accept that. Fortunately, I have some wonderful clients who have promised me a drink should we meet down there. Because one of the things that I had to say a lot was, look, if you're going to terminate your employees, do it before April 1st, because come April 1st, the Families First Coronavirus Act is going to be taking effect. And that's going to have some significant ramifications. What does that mean? Well, as of April 1st, every employer in the United States that has between 1 and 500 employees should have put up their notice regarding the Coronavirus Response Act, or FFCRA. If you were working remotely or you were remotely working then, you should have distributed electronically. If you need the notice, all you have to do is send me an email. My email is on the webinar for everybody who's listening. It's easy. It's tarmstrong@wilentz.com. And all you have to put in the email is notice. I'll know what you're talking about. I'll send you the link. So what does it mean when you have to comply? When you have to comply, you have to have an understanding that there are two components. The first component is exactly what's on this slide. It's a paid sick leave. And the second component is an extended FMLA. And what the legislature said is this law, as I told you, took effect April 1st. It stays in effect right now until December 31st, 2020, when it sunsets. They may extend it. I don't know. So we have these 6 categories, and these are the categories of individuals this law was designed to assist. And the first one is, I'm an employee, I'm subject to a federal, state, or local quarantine. We're having lots of those in New Jersey with the travel advisory. I did have a client who wanted to debate the word order with me. And I told them if they wanted to assert that the travel advisory was not an order and they were not going to provide their employee with the paid sick leave, I would be happy to litigate that for them. And I would love to be involved in the case that decides that issue, because I don't know what the answer is. I don't know what the answer is. I would err on the side of caution and saying that is a quarantine order, even though it is an advisory. They say we expect compliance. And I would err on the side of having that an employee who is subject to that be qualified to the paid sick leave. Number 2 is an employee who's been advised by a healthcare provider that they need to quarantine because of COVID-19. Number 3 is an employee who's experiencing symptoms and seeking medical diagnosis. That took a little bit of a weird turn in the last couple of weeks because now it's taking 7 to 10 days to get COVID-19 test results in some facilities. So the first 3 are about me. They're all about me. 4, 5, and 6 are, well, 4 and 5 are not. 6, I'm here to tell you, I'm not sure what 6 means. I've never had anybody talk to me about 6. I'm not sure anybody knows what 6 means. So we really focus on 1 through 5. 4 is, it's about me taking care of someone who is subject to 1 or 2. And number 5 is about me staying home because of my son or daughter. School, daycare, camp is either closed or unavailable due to COVID-19. So what happens is the following. If you have someone in one of those categories, what does it mean? So if we look at the next slide, I did my best to try and explain it. So let's talk about 1, 2, 3. That is the paid sick leave part of the Families First Coronavirus Act. It is a one-shot deal. I do not get 2 weeks or 80 hours. It's really 80 hours. I do not get 80 hours this month, and then next month I need 80 hours because my kids' camp closed down. The sick leave is a one-shot deal. So if I'm asking for paid sick leave under 1, 2, or 3, it's $511 per day or my daily rate, whichever is less. And I get paid that for 2 weeks. If I'm seeking the paid sick leave for 4 or 5, I'm taking care of someone else, maybe grandma who has COPD, who's subject to a quarantine, or my child's school is closed. I'm also entitled to the 80 hours or 2 weeks of paid sick leave. And yes, people who work part-time are entitled to this, but I'm entitled to it at a different rate. It's $200 per day or 2/3 of my daily rate, whichever's lesser. And again, I get that for 80 hours. The extended FMLA part of this leave is only, underline only, for number 5. It is only for someone who is out taking care of their child because their school or daycare is unavailable or closed. And what that says is the following. The first 2, it's a 12-week protected leave. Much like if someone were out on FLA or FMLA. All those are job holding statutes. So that part of this is in existence. It's a holding statute. Now, the difference is it becomes a paid FMLA. None of the other protected leaves are. The first 2 weeks are unpaid. And I know some of you are going to say, but wait a minute, Tracy, you told me I could get 2 weeks of paid sick leave. Yes, you can. An employee can say, pay me my 2 weeks sick leave, and that's going to be the first 2 weeks of my FMLA, and then I'm going to get my 10 weeks paid under the extended FMLA. But let's say I already took it. Then my first 2 weeks would be unpaid by my employer. I may be able to be paid by disability, FLI, unemployment, or some other mechanism. But the first 2 weeks would be unpaid by my employer. And then the last 10 weeks of this protected 12-week leave would be paid again at the rate of $200 a day or 2/3 of my daily rate for 10 weeks. Now, just so you know, I know some of you may be thinking, wait a minute, Tracy, FMLA, that means they got to work for a year first. Not this one. This one, to extended FMLA, they only have to work for you for 30 days. For paid sick leave, once my big toe crosses your threshold and I am your employee, I am eligible for FFCRA paid sick leave. So those are the 2 types of leaves. But again, I cannot stress that the FMLA portion of that is only for the number 5, the taking care of my child. And if you would be kind enough to go to the next slide, there are ways to be exempt from the FFCRA, but I'm telling you, it is a tough road. And that is first and foremost through a small business exception. And some of you may be saying, that's me, that's me, that's me. I'm under 50 employees. And when you're talking about FMLA, that's the end of our discussion. I say, do you have 50 employees? You say, no, Tracy. I say, excellent. Let's move on. Now let me work my way down. You have 30 employees and we go from there. But that is not the case with the small business exemption under the FFCRA. I have put up here for you the 3 reasons for which you can argue you don't have to comply. And when they originally published this, they said you had to apply to the Secretary of Labor. I kind of laughed because I figured the Secretary of Labor got about 2 million emails the next day because they quickly said, cut it out, keep your information to yourself. And if you believe that you are exempt and you are not going to comply and you're going to tell your employees how sad, too bad, then you keep the documentation that shows I meet the standards for 1, 2, or 3, which basically says I would be out of business. And when we come audit you because one of your employee complains, then you can show us the documentation and we'll let you know whether or not you're right or wrong. How's that for fun? The other, it's not an exemption. So that's an exemption. That says I don't have to comply as an employer. The other part of this law is an exclusion. And what that says is an employer can exclude an employee that is a healthcare provider. What is a healthcare provider? A long laundry list. If you have a question and you want to know the whole laundry list, shoot me an email, just say healthcare provider laundry list. I'll know what you mean. But there is a very broad definition of anyone employed at a doctor's office. So they can choose to exclude their employees. So maybe they're going to say, we're going to exclude coverage of the extended FMLA, or we're going to exclude coverage of the Paid Sick Leave Act, or we're going to comply with both, or we're going to comply with neither. Be careful if you are going to say we're going to exclude this group and not this group. That is something that really needs to be talked through with your employment counsel. I think that is a risk. I also have had employers who say, I didn't know I can exclude and I was complying, but now I don't want to comply. I have everybody coming back and this is crazy. So again, I would speak to counsel and make sure that you are making that decision in a way that you can justify that change. Now, I've talked about a lot of payments. So if you would be kind enough to go to the next slide, hopefully this will at least alleviate a little bit of the worries, because the next couple slides, you can really turn over to your accountant, because what I do want to tell you is I've talked about a lot of money coming out of your pockets, but it is really a cash flow issue for you. It is not a net loss to your bottom line, because what will happen is for every dollar I'm your employee, you pay me $5,111 because I max out on my sick leave. You will get a dollar for dollar credit against your payroll taxes following those payments you make to me. So if you normally pay $10,000 in payroll taxes, you'll pay a little less than $5,000 in payroll taxes. So you do get a credit. You want to be sure that you've gathered the appropriate information for your accountant to give you that credit, or whoever's doing it. If you're going to comply with this, you also need to talk to your payroll company. So this gives you a little bit of outline. I will tell you in this slide and the next slide are FAQs from the IRS section regarding the tax implications of payments under the Family First Coronavirus Act. So if you go to the next slide, please, and I'm sorry, the next slide. So it's the next 3 slides. So you'll see at the bottom here, it's talking about the FAQs. If you go to the IRS website, if my memory serves me correctly, it is 44 and 45, and that will tell you everything that you need to know about getting this credit. And it's important because you don't want to make these payments and not be able to take the tax credit. So if you could hop to the next slide, that would be great. Again, you guys, oh, there's the link. There you go. So it's 4 slides on the credit. So you guys will be able to go to that link and see what you need to see as far as getting a tax credit. So if we could hop to the next slide, I'm gonna make sure that I get this done in time. Real quick about this, I'm not a big fan of the New Jersey Department of Labor. They're usually my nemesis. They created a great chart. I will give credit where credit is due. If you want to find this chart online, you type in New Jersey Gov COVID-19 chart. This will pop right up. It comes in other languages. It is a great, if this happens, then what? And it's a great resource for you. It's a great resource for you to communicate with your employees. Next slide, please. So I'm going to go through this fairly quickly. PPP, you heard a lot about it. From my point of view, what's important for you to be prepared for is that is your FTEE requirement of having to have all these full-time employees. When it first happened, we had a lot of people saying, no, thank you, I'm not ready to come back. No, thank you, I don't want you to pay me that PPP money because I'm making more money on unemployment. Could you please cut it out and not pay me that money? So what the government did quickly pay attention and said, okay, hold on. If you have an employee, you must document the offer you're making to them, the hours that you're offering them, the amount that you'll pay them, and you must document that they are rejecting it. So some employees are going to ignore you. So what we suggest is you put in there, if you ignore us, we'll assume you're rejecting our offer. And what they said is if you have an employee who rejects your offer, you have to let the Department of Unemployment know within 30 days. And there's a link. Thank you to Dr. Gorab for telling me about the link. There's a link to the form that you have to fill out. Because again, you don't want to have that person counted against you in your forgiveness. And the Department of Unemployment, the commissioner said at a webinar that I was on, and I decided that I thought it was actually pretty clever, said the following, and that is unemployment chooses you. You don't get to choose unemployment. So the Department of Unemployment wants to make sure that they're not paying someone who's been offered a job. So they're incentivized to have this information. And you'll see listed there also are other reasons that an employee would not count against you in your FTE forgiveness, your PPP forgiveness based on your FTE. Please work with your accountants and your attorneys on working through this to make sure employees that are missing aren't going to affect your forgiveness. Next slide, please. Thank you. And so I'm trying to very quickly move on, so I hopefully leave a little time for some questions. To what happens? We have all these employees who are coming back, and it's causing consternation. Can I require a virus test? Yes. I'm going to tell you, I almost fell out of my chair when the EEOC said that, because they're pretty tough when it comes to the ADA restrictions about don't ask people, don't, you can't, no. They said, yes, you can take temperatures. Yes, you can test for the virus. No, you may not test for the antibody. I don't know why. That's their line in the sand. Maybe because it's a little more invasive, because it's your blood, but that's their line in the sand. I have some links here. It's pretty interesting reading. It can be, I will forewarn you, it can be overwhelming when we're talking about these issues. So the next worry that we often have, if you would be kind enough to go to the next slide, is what do I do when I have a positive case? Right? What do I have to report it? So you need to determine, are you an entity that must report to OSHA? You may be exempt. You may be exempt because of your size. You may be exempt because of what you do, but you need to find that out and also figure out what you have to report. And if you would be kind enough to go to the next slide, this is just somewhat of an example of when you have to report COVID-19 confirmed cases from your place of employment, or unfortunately, if there's a fatality, even if you're exempt, if you have a fatality. The irony of this slide and this whole discussion is, I don't know, you could have a confirmed case of COVID-19, and that person could have not gotten it at work. So it's going to be which brings me to something else regarding unemployment and having people not come back to work. I know a lot of people are worried about their rating for next year. The Department of Labor said they are going to look into doing something to assist with that. I had something on a previous slide I want to touch on really quickly. Releases. Do not ask employees to sign waivers or releases. That's not going to be valid. If an employee gets COVID-19 at work and they can prove it, and that's a whole nother discussion, it's going to be covered by your workers' comp. If you have concerns, call your workers' comp carrier. Say, these are the steps I'm taking. Are you good with that? Are you going to provide me coverage? I personally think they should be reaching out to you, but if you want to be cautious, that's something that you can do. The only thing that you may want to consider is an informed consent type of document for invitees, people that aren't your employees. And again, you would need to review that to decide internally, is that something you want to do, and speak to counsel about getting such a document drafted. Is it going to be an informed consent? Is it going to be an informed consent with a waiver? But regarding your employees, every article I've read said they would not be upheld. And also it is not going to be looked upon kindly. There is a power struggle between an employer and an employee. And it's just not something that's recommended. And again, the OSHA link is on the previous slide. So if you could go to the next slide, please. Okay, real quick, leave issues. The EEOC has said that these are the rapid rise in cases that they are seeing. Do not forget that this law is in effect until December 31st. Do not forget all of the other laws that we have out there. At the end of the FFCRA, if you have someone who is still out, who needs to take care of a family member or a child, they may be entitled to family leave insurance. Family leave insurance law was changed a year ago. It used to say this is not a job holding statute. In June of 2019, they added an retaliation provision that says if you cannot retaliate against someone for taking that type of leave, including not bringing them back to work. So I don't know how that complies with it being not a job holding statute, but between that happening, we didn't have time for any cases because now we have COVID-19. So be very careful at the end of an FFCRA leave. Don't just say goodbye to somebody. Your obligation as an employer is to say, hey, you may still be eligible for FLI. Let me tell you how to apply. If you are 30 or more employees, you must comply with the New Jersey Family Leave Act, which was amended on April 17th of this year to include childcare issues. So that's another 12 weeks of protected leave. You must consider reasonable accommodations when someone comes to you and says, hey, look, I have asthma, so I need an N95 mask, or I have asthma and I'm going to need to wear my mask and a face shield, and that office is open over there. I want to sit in that office. Do not just say to somebody, I'm sorry, we can't do that. You must engage in the interactive process. You must have a discussion. You must. Face masks, the CDC just came out. I wrote a blog on it last week. If you're interested in our blog, we have a great blog. It's called The Employer's Legal Resource. We used to blog once a week in a normal world. I looked the other day, we're blogging like 20 times a month, which I apologize in advance, but I'm telling you, our blogs are short, sweet, to the point. We don't give you legalese. But the CDC is recommending masks if you can, if it's appropriate, but they do leave it in the discretion of the employer. You don't have to provide masks, but they say masks do not replace social distancing. Travel advisory, voluntary, but, quote, we expect compliance. If you have employees going and they come back, I'm going to tell you, when they come back and they say, hey, I was in Texas, all the other employees around that person are going to come to you screaming that they should be home under a travel advisory. And then you have to say, oh, Tracy, are they covered by FFCRA? Can they get family leave insurance? Can they get unemployment? They may be able to get unemployment. It's the first time ever in history you can get unemployment and still be an employee. It's the twilight zone. So things are not normal. But you cannot just say, I'm only going to focus on the coronavirus issues. You have to remember we have all these other issues here. And if someone comes to you and says, I need an accommodation, it is a violation of the law to not engage in the, quote, interactive process. And interactive means just what it says, interactive. So if you could go to the next slide, and I hope it says thank you. Oh, see, ta-da! It does. It says thank you with 3 minutes to spare. So I will be quiet at this point and let our moderator take back over. Thank you for your time and attention.
Tracy, thank you. Thank you for your energy. Thank you for shedding light on these matters and providing so much content in such a short amount of time. So truly, thank you. I would like to just be able to have our presenters answer a question or two. So I'm going to go back to Dr. Gorab right now, and I would like to ask you, what suggestions do you have for dental practices as to how they are to deal with dental aerosol and splatter at this time and the concerns surrounding that?
So this is really a hot topic right now in the dental community. There are a lot of companies out there that are selling equipment that is supposed to be, you know, suctioning up all the aerosol in the room and in your area. I'm not sure if this is the science or this is the hype that I was talking about before, because these companies may or may not have done research. They put a machine out there, they're selling it to you. It looks good, it looks shiny, but who knows if it's even working. To be very honest with you, I have some good news, and people should really email me for this article. There was just an article that was completed. It's ready for publication on how an HVE suction alone, an 8mm HVE suction alone, eliminates all dental aerosol. This was put out by a colleague, Dr. Alberto, at Rutgers Dental School. She's waiting for this to be published. And it really is very compelling evidence on how it takes care of all the dental aerosol in operative and the majority of aerosol in hygiene. So ggjawdoc@gmail.com, and I will send you a copy of that article, not yet published. The other thing you can do is to look at your trap, your HVE trap. Oftentimes there's a second port on the bottom. And if you get a second HVE hose and hook it to a small funnel, you can effectively turn your suction on and have two HVE hoses, one in the mouth and one outside the mouth. So I don't know that you really need all of this expensive equipment. I think there is some science now based on limitation of the aerosol. But anyway, and if you want a copy and if you want a picture of the setup for that, let me know and I'll get that to you as well. But there's more to come on that.
Dr. Gorab, while I have you, I'm just going to continue to ask you another question.
Sure.
How are you handling contacting your patients about the changes in your office and bringing them back into your office?
So again, as part of my lecture, this is really important to re-engage your patients and to let them know that you're now a different office. I mean, there are a lot of different ways you can do it. You can do it through your website. You can send them a letter. You can even, on your spare time, make personal calls to them. You can email them or just simply when you call them for their recare appointments, just start to engage them in the conversation about how your office is now changed. Tell them about, your new procedures in the office, infection control, equipment, the questionnaires, having to take temperatures, anything like that. Those are all the different methods and the modes whereby you can contact them and get them information.
Thank you. Tracy, I'm just going to come over to you since we're running short of time, and I would just like to at least be able to ask you a question or two. How are you advising? Sure. How are you advising your clients when they reach out to you and let you know that one of their employees has tested positive for COVID-19?
Okay, so the problem is a lot of times the answer to some of the questions we get asked is, I don't know. So I have had that happen. I'm sad to report. And what we have done is it really depends on the type of industry the employee is in, how many people they were around, what their status is. Are they waiting for a COVID test because they went to the doctor and the doctor suggested it? Are they waiting for a COVID test because they have symptoms? Again, what proximity they were to other people. So it really is a case-by-case basis. I had one, and it's also your tolerance level, right? I had one client said, if I tell somebody that this individual got a COVID test and I'm going to have total panic. And he was feeling fine. He went to the doctor for another issue and they gave him a COVID test. It ended up being negative. But I said, look, you have to talk about what the risks are. I had another client who said, no way. She had someone who took a rapid test. It was positive, and we immediately told everybody. And I was actually surprised at the reaction. It was now I will tell you, this was a business that there were younger employees, and they were all like, okay. And they went and they got their own test. Nobody else was positive, and everybody went on their merry way. So it just depends. The other thing that some clients have talked about is if they have concerns that it's possible outbreak, that you may have to involve the Department of Health. Or you can always reach out to the Department of Health and ask if you want cover. The other thing that you want to do is always involve your workers' comp carrier, because you never want to put yourself in a position that you don't have coverage. I personally, again, think they should be reaching out to you guys to talk to you, but my understanding is that's not happening. So that's a very long-winded answer, and the short answer is it depends on the circumstances.
Okay, and one other question that we're seeing so much in the news, it's affecting us personally, possibly with family members. What happens when an employee goes to a state that's not on the list, but then it appears on the list while they are away?
Unfortunately, that is going to happen. That last I looked, there were 22 states on the list. I'm sure there will be more. And they would, you have somebody who you thought was going to be on vacation for 1 week, and if you decide to comply with the travel advisory, they're going to be on vacation for 3 weeks. The question is, do they have to get paid? Again, they could probably use their FFCRA or get paid through other methods. And the travel advisory, by the way, says a test does not replace the quarantine, because you can test on day 3 negative and test on day 7 positive. So they said that does not. But again, it is voluntary. The problem is if you don't comply and those coworkers know that that person was in Texas, more likely than not, they're going to have something to say about it. And it can cause some difficult conversations in the workplace. And again, it's voluntary, but quote, compliance is expected. So unfortunately in that situation, now if someone can work remotely, I had the story I told you about Texas. That happened to my client. The gentleman came back from Texas, walked in the office. They said, get out. And he went home and he worked from home for 2 weeks. It was fine. So if you have someone who can work remotely, it's less concerning than if I know a lot of your employees can't work remotely. So, the backyard may be a good place to take vacation for a while, or the front yard, or Dr. Gorab told me about Tar Beach. So beach on the driveway. So people's vacations may be looking very different this year.
And then I'm going to ask you your final question and then go back to Dr. Gorab. How about, should we be having questionnaires to be filled out by employees?
So the answer is you can. They can be a little cumbersome. If you are temperature checking and having a brief questionnaire, for example, did you go anywhere? Did you socially distance last night? Did you go to an activity last night? You just have to be careful regarding people's privacy. A lot of people say the word HIPAA. You guys, because you're in the health profession, may have HIPAA issues, but they may not be what you think they are. For me, from an employment standpoint, it's a privacy issue, and that's what the ADA looks at, and through the EEOC. So if you are going to ask those questions, be careful as to how you keep that information. If you keep that information, who gets that information and where is it stored? So again, it's a personal preference and a tolerance level. I do know that some employers do have a questionnaire every day. Some have them once a week, and I have others who don't have a questionnaire. I have others who are taking a temperature every day. So you really have to find what your tolerance level is and what works for you.
Okay, thank you. Okay, I'm going to turn it over to Dr. Gorab for one last question, and that is, what should practices do if they are unable to get PPE equipment at this time? What's available to them?
Okay, so again, this is part of this is going to go back to the CDC, but because the CDC has contingency plans for a limited supply of PPE. Basically, the things we're talking about are masks and gowns. Those are the main things. We have 2 types of masks. We have the regular surgical masks, plus we have the N95s. Most important thing is to use the mask that's specific for the duty in the office. The other thing that you have to understand is that the virus is killed by 3 things: by heat, by chemicals, or ultraviolet light. So the masks, actually not the N95s, but the regular mask, if you had to, and if you were running out of these things, you can put them in a seal and peel, and they will cook in your autoclave, and they will come out just fine. I feel perfectly comfortable wearing a mask that's been autoclaved. Now, I wouldn't use it on a regular basis, but only if I had limitation of supply in the future. N95 masks can't go in the autoclave, but they can be cleaned by ultraviolet light. As far as the gowns go, a couple different options. I mean, if you have a washer and dryer in your office, you can buy reusable gowns and you can wash them. And interesting fact is that even the disposable gowns can be washed. And it sounds unusual, but they can. If you buy some of those zip bags that are perforated that you put like delicates in the laundry, you know, you can put a disposable gown in there and it'll come out of the washer perfectly fine. And that's a company that just sent me sterilization instructions for the disposable gowns. And the last thing is you can use a service. I mean, you can employ a service to bring you gowns too. So the biggest things are the masks and the gowns, and I hope that you know, helps to, you know, help people out with their limited supply.
Thank you. Well, we're over time, and that will be wrapping up our webinar for this evening. We truly want to thank our webinar audience for joining us, and truly want to extend a special thank you for our presenters. They've done a great job this evening. We will be providing you the recording as well as the slides. You will be receiving that within 24 hours. And please email us any questions either to our COVID-19@sacsllp.com or to the presenters themselves. And like I said, we will be sure to return the answers to your questions timely. Thanks again for joining us. Have a good night.